Oftentimes, when we think of broken bones or some type of orthopedic injury, that's what we think of. We think of a bad hit in the NFL at a football game. Maybe it's baseball or something of that nature, or a kid climbing a fence and falling off and breaking his or her arm. But the reality is, a lot of these orthopedic injuries, broken bones or a problem with your hips and knees, they happen over a longer duration, a longer period of time. It's this constant wear and tear. And then sometimes it might be that final thing that causes it to snap or something of that nature. So the reality is a lot of Americans and a lot of people in Michigan, Southeast Michigan, are suffering with these things as well, wondering what they should do about it. I want to bring in orthopedic specialist, Dr. Matthew Caid. He is in Brighton, Michigan. He's joining us now and joins us to discuss the most common types of injuries, the most common surgeries that he encounters, focusing on hip and knee and arthritis and trauma. And we're also going to explore some of the advancements in orthopedics that we are now, thankfully, we have in this day and age with technology and just common knowledge as we learn more about the various techniques and the outcomes of modern surgeries. Dr. Caid, it's very nice to have you. Thank you for your time.
Hey, Tom. Thanks for having me. Appreciate you.
Very much appreciate it. And the reality is, I've got a lot of friends who get into a certain age group and they're like, I mean, it could be in their 40s, could be in their 50s, but suddenly my hips hurt me, my knees hurt me. What are some of the common, types of injuries that you deal with, and what's the genesis oftentimes of those injuries?
Typically, arthritis takes years to build up, and it's as simple as a sprain, or they twist their knee, or they take a fall, and it really irritates that pre-existing arthritis that really gets inflamed and kind of starts a chain reaction. So, and it's really common. We probably do about 500,000 hip replacements in the U.S. each year, and we probably do about 800,000 knee replacements a year. And
that is remarkable.
The numbers keep going up,
So, when you're younger and you think about, what are the things that might down the road lead me to maybe developing arthritis? What are the common things that we do that maybe we can prevent this outcome, this arthritic outcome that we don't want?
Actual trauma, so bad falls, broken bones, things like that can lead you to have arthritis. We call it post-traumatic arthritis. But I mean, most people, it's just wear and tear and genetics. If you did happen to smoke or use steroids a lot, things like that but that's less common. Usually it's just, as people live longer, you wear out your joints eventually.
Right. So is that most common in the hip and the knee? Is that what you most often see?
I would say knee is most common, then hip, and kind of goes from there.
So you specialize, I know, in trauma cases, right? So that's one of your areas that you really hone in on. And so when you think about the increase in trauma-related injuries over the years, what trends do you see in terms of that you notice in the types of injuries that people are experiencing when it comes to trauma?
Yeah, the trauma that I see at some of the local hospitals I take call at, it's a lot of the elderly people who are tripping at night, honestly. Like we see that loose rugs, no handrails, limited light leads people to take a spill, and they usually see us in the ER, and then it's, instead of a hip replacement that we plan, it's a hip replacement because they broke their hip, actually. So,
at that point, there's not much that you can do other than if you break the hip. I mean, what are the options at that point?
Yeah, the three main ones are you put a couple pins across, or you put a rod down the hip, or you do a replacement. So I do a minimally invasive anterior hip replacement, even for traumas. So they do pretty well. They bounce back pretty well.
Okay. So, how is orthopedics advanced? You think about, I was involved in an orthopedic practice, gosh, I think it was 25 years ago. And back then we thought, well, look at all these great advancements in orthopedics. And it was true back then, but now it's 2024. What have you noticed in your practice, in your career?
Yeah, I think that robotics has come a long way. It's not that new. It's been going on for at least 10, 15 years. The most recent thing is augmented reality, which is where the surgeon wears special glasses and you can see a 3D overlay on top of the knee.
Oh, wow.
That's from the CT data that we have. So it's similar to robotics where just the robot can see where to make cuts, but this is actually I can move things around. It's in its infancy, but that's probably the newest thing. I don't do that in practice, but it's coming down the road.
But that would be in real time. So during
Yeah.
the surgery, you can see the various. I mean, the more detail I would imagine, the better for you, for the
Yes.
surgeon.
Yes, it's great. The new technology is really it's not there yet, but it's helping.
But there is a lot out there. So how does that, these advancements that we have, and what you see in your practice, how has that affected the outcomes of the various surgeries?
Yeah, I think that it does a lot of things. So it avoids complications and errors, which are very low in a hip or knee replacement anyway. But we're allowed to do things that are a little less invasive, so people's recovery is faster. And then, especially with knee replacements, we're really focused on balancing the ligaments. And so if we can tension these ligaments in real time with data from a CT scan, it really helps. So.
Have you noticed, because it seems like, from a layman's perspective, observationally, when I look around, it seems to me that there are amongst younger people, as more younger people are getting involved in various sporting activities, that I don't know if there is, but it seems to me there is a rise in some of these traumatic injuries amongst younger people. Maybe it's high school, maybe it's even, middle school, people are playing football and all those kinds of things, skateboarding, whatever it is.
Yeah.
What are some things that they can do at that age to minimize some of these breaks and various injuries they might sustain?
I think a lot of it is technique and strength training. So if you have a good strength coach who can teach you the proper way to jump and land and have those stabilizing muscles strong, hopefully you can avoid, twisting an ankle or tearing an ACL. So that would be my biggest piece of advice.
I think that's super important, because you think about it. I mean, the joints can only sustain so much over time, but if you got strong, say the knee, for example, if you got a strong thigh muscle around it, whatever is the supportive structure around that knee, that certainly would help.
Yeah.
So like leg press, those types of maybe exercises.
That stuff. And then they have, they can do really good balance work, stuff that you would never really do in a normal gym. The physical therapist can kind of teach you. And then when that joint, whether it's an ankle or a knee, faces something that's a little awkward, then they can kind of stabilize themselves without even thinking about it, because they've practiced it. They've practiced those balancing activities.
Some of the greatest running backs in the NFL, I've seen them train, and balance is such a big part of it. And some of these, like LaDainian Tomlinson and some of these old guys, that's what they're really honing in on. And that's probably a big, obviously they don't want to get tackled and they want to stay upright, but not getting tackled helps prevent an injury as well. What is it? Let us into a little bit of your genesis, how you got into orthopedics. Dr. Matthew Caid. When you were younger and you were kind of deciding what your career trajectory was going to look like, what led you into this field?
Growing up, I spent a lot of time with my grandfather. Took him to a lot of doctor's appointments, and I just was like, wow, this is pretty cool. And then as I went on in school, I went to Michigan State and got into all the science classes and thrived and did well. And then I thought, this could be a real thing. And then after college, I worked at an OR as an OR tech, and then I just kept building off that. And that's kind of
that's amazing.
How it came about.
That's a great way to figure things out. When we're thinking about a potential career path, what are you not only interested in? That's a big part of it. But what are you good at?
Yeah.
And if you're good at all, I know the prerequisites in medicine are very, very difficult. But if you're succeeding in that, I thought about going down that road. But the prerequisites are pretty tough. So I thought, I might be interested, but maybe I'm not as good as that. As a Dr. Matthew Caid would be. So that's fascinating. How can people get a hold of you?
My office is right down Grand River here in Brighton. It's advancedorthopedics.net is where you can find me and my partners. So, but we're right here. We're right next to the Trinity building on Grand River.
Great. Advancedorthopedics.net is the website. Dr. Matthew Caid, so good to have you. Thank you for your time, and we'll keep having you back in the program.